And maybe face to face with our extinction, we may wise up enough to start working together for a better world, for a better material ambience, first of all, in which human dignity is possible. It's hard to have human dignity if you're an economic or physical slave, if you don't have enough to eat or drink, if you are cold when it's cold and wet when it's raining because you've got no shelter, when your children have no possible hope for an education, when you never see a doctor from the day you're born to the day you die, and there's no medicine around even if there isn't a doctor, when all of your hope is shriveled up because people are taking the good things of the earth, including intelligence and talent as well as treasure, and spending them mostly on machines of destruction when we might be spending them on education and health and creating a better world.
Please welcome co-founder and executive director of Andean Health and Development, Dr. David Gaus, from the class of 1984.
It's hard to have human dignity when you've never seen a doctor from the day you're born until the day you die. Now, we all know what a great global citizen Father Ted was, but I believe that Father Ted had a special place in his heart for Latin America, and that quotation came from his experiences in South America. So, it's 1997. Father Hesburgh is the co-founder and president of our newly minted organization, Andean Health and Development. I'm in rural Ecuador trying to provide healthcare services with a couple of the great Ecuadorian physicians in a very small, ill-equipped room. And I could almost hear Father Ted saying to me, "David, now do you know what I mean about human dignity?" Why do I say that? So a woman brings in her 9-year-old son who was just bitten by a snake, a very venomous snake. And that boy says to me, "Doc, I'm going to die." I was caught off guard. It's not often that you hear a patient say that to you, let alone a 9-year-old boy. I had training in tropical medicine, and I thought I might be able to handle this. Well, there was no anti-venom at all, anywhere. I had to put the boy in the back of a pickup truck, ship him up to the Capitol because there are no hospitals around. On the way up to the hospital, he died. A 30-year-old man brings in his wife who was pregnant. He's carrying her in his arms. And he says, "Doc, she's pregnant and she was at home and she had a seizure and she hasn't woken up yet. Please help me wake her up." Well, this woman had eclampsia, a major killer of pregnant women all over the globe. And I had to tell her husband that she had already just died. Another boy, about 20 years old, was spraying pesticide out in the fields to keep his plants safe. Now, these are chemicals that, when used in the United States, people wore full body suits, not a single inch of their skin is exposed. Yet this boy was wearing a tank top, shorts, flip-flops, and had a big tank of pesticide on his back and was spraying his crops and walking through the clouds of the pesticide as he was going. He came into our small, ill-equipped clinic. We knew something about this problem, but unfortunately he had something called pulmonary edema where his lungs were starting to fill up with fluid. And we didn't have a way to intubate him or put him on a mechanical ventilator at that time, so we had to ship him up to the Capitol. He got to the big public hospital. The physician that was running the emergency department that night had never seen an organophosphate pesticide toxicity before. So he put the patient off in the corner and went on attending other patients, and an hour later, that young man unfortunately died. A 20-year-old woman came in, had belly pain for 5 days. She was walking around town for 5 days with abdominal pain. No one ever figured out why she never came in to see us until the end, but after 5 days, she came in and she had a board-like abdomen and had appendicitis that had ruptured. We sent her up to the Capitol, and she ultimately died in the Capitol. And so after these experiences, we started thinking to ourselves, we have to do something, we should try and do something about this. Why aren't there any hospitals around here? So I came back to campus, had my usual annual meeting up in Father Ted's office, and Father Ted said, "Hey, David, it sounds like you're trying to talk yourself into building a hospital. Why don't you build one? And build a big one." When the architects asked me how many volumes of books I want in our library that we built many years ago, they thought maybe 500,000. I said, "No, I need 5 million. So build a hospital, and we'll figure out how to raise money for it." So that worked. We built a small 15-bed hospital. Father Ted came down for the inauguration of the hospital. And as I'm sitting there, just about to open the hospital, a completed hospital, I suddenly had a panic attack, and I leaned over and asked Father Ted, "Hey, Father Ted, I don't know how to run a hospital. And I don't know, how are we going to make this thing, how are we going to pay for this thing, how are we going to make this thing financially self-sustainable? I mean, these are people living on $2 a day, and healthcare services are expensive." And Father Ted looks at me kind of funny and says, "David, correct me if I'm wrong, but didn't you study business administration at Notre Dame?" And I said, "Yeah." And he said, "Okay, you got this, go figure it out, you'll figure this out." So then, after another year or two go by, I come back and I tell Father Ted, "We're having a hard time finding physicians that can actually work at this place. Most of them come from the capital. Our people in the countryside have a different view of health. It's not working." And he said, "Train them." That sounds like a good idea. So since then, we partnered with the Catholic University in Ecuador, and we've graduated about 80 physicians over the last 10 years, Ecuadorian physicians. So Father Ted pushed us hard to think about how to have an impact on healthcare services to address some of these human indignities that he talked about. And Father Ted, I really believe, was called and had a much bigger purpose in life that transcended the university. And that he used his position as a university president to tackle national problems and international problems. And so it should come as no surprise to you that after we finished that first hospital, after we got it to financial self-sustainability after 7 years taking care of everybody that comes into the place, after we started training residents, and after we built a second hospital that was about 4 times the size of the first one that the Ecuadorians wanted to call Hesburgh Hospital, it should come as no surprise to you that when I asked Father Ted, "Where do you think we should go from here?" he said, "Well, when you look around Latin America, are there other places that are doing this kind of work? Is anything you're doing unique? Are there opportunities here for you to share your experiences with people around Ecuador and maybe beyond?" And so in the same way that Father Ted, who as university president, an institution that had very little political power, used that political power to address these things and guide it, and used his theology to guide that process. He called on us and he challenged us to go beyond the walls of our hospitals and healthcare system to address policy at a much broader level in Ecuador and beyond. And so because of that, we committed a significant amount of time and energy to begin to publish. And we created our own medical manual. And it's a manual for those of you who are physicians out there. There's a thing called the Washington Manual. Everyone walks around with these things in medical school. That doesn't work in a place like rural Ecuador. There's no contextualization of that kind of a manual. So we wrote our own manual. It's on its 3rd edition right now. We also have a medical journal that comes out every 4 months. All of the authors are Ecuadorian. They're all topics around Ecuadorian healthcare. And both of those things, the manual and the scientific publication, are online, and we get 10,000 visits per month from physicians from 6 or 7 different countries around Latin America. And so I'm going to tell you that I got to say that I now understand what Father Ted was talking about when it comes to healthcare and health in general and human dignity. One of the ugliest manifestations of poverty is to become ill in a failing healthcare system and have nowhere to turn. And so this is a story about a great man, Ted Hesburgh, who instilled in us, a couple of Americans and a lot of Ecuadorians, the courage to begin to address some of these human indignities in a forgotten corner of the planet. Thanks, Father Ted, and thank you.